The topic of ethics was the theme of the second annual UMB Interprofessional Education Day, with a turnout even greater than last year's. Students from all of the schools poured in for their assignments in 11 case studies built upon that theme.
Please join me in a robust welcome for Dr. Rushton.
But the day's lessons were far broader for hundreds who gathered for a keynote speech by Johns Hopkins Dr. Cinda Rushton and for an introduction to the Earls, the event's sponsors. After Nursing Dean Jane Kirschling thanked the Earls in her role as IPE director, she explained why and how students would learn key skills or competencies that educators agree are needed for collaborative practice in the future.
And this is the framework that was laid out in the core competencies. So the work has to be done within a community and population-oriented context, that it has to be patient and family-centered. It will occur across the learning continuum. So while you're being exposed to it as part of your entry into your health professions field, it will continue over the course of your career. And an example of a competency is to recognize and respect the unique cultures, values, roles and responsibilities, and expertise of other health professions.
I can't stand to see her in pain. I know she wouldn't want to live like this. So I just want to do the best for her to keep her as comfortable as possible without prolonging her unnecessarily.
Actors known as standardized patients were used in several scenarios, such as this case, centering on end-of-life care.
Knowing where we stand at this moment truly helps us to feel as if we are part. And as you said, that empathy is so huge, because let's be honest, at some point, this conversation is going to get to, she has 6 months to live, or it's going to get to hospice.
I think it's important to understand where the family is coming from at this point, how much they actually know and how much of that is actually accurate. So knowing their perspectives on it and being able to provide them with more accurate information, I think is kind of key.
Okay, everyone, the family has arrived. We're going to go ahead and let the team get started.
A scenario led by Nursing Clinical Education Director Kathy Chavone centered on genetics. An expectant couple meets their team at a prenatal appointment where they learn the fetus appears to have multiple birth defects. Standardized patients help students sort out their feelings and professional roles, says the scenario leader.
If you choose to have the baby, there's lots of different options to ensure that it's healthy.
I don't choose to have the baby. I don't know what that means. So she's pregnant, she's going to have a baby.
Okay. So the standardized patients bring that realism to the situation. They bring that emotion. They really trigger those emotions in the students, and they really encourage the students to look at their own biases and stereotypes to ensure that that doesn't influence how the family is counseled.
We have a lot of options that we can pursue to help make sure things are as healthy as possible.
The students will work together as an interdisciplinary team, an interprofessional team, to decide on what options are available to the family and then advise the family of the best course of action.
From the outset, the scenario's faculty encouraged students to hear out other disciplines as teams at each table explored the case they would confront.
They might just have completely divergent reactions. And so we need to be prepared for that, to have someone be ready to support if there's blame, anger, like, well, this is your fault, because of fill in the blank. You drank, for the first 3 months or whatever.
Schizophrenics, like their personalities in general, like what is she thinking? Like she, if you think about it, like she might think completely different than what her husband thinks.
Where I'm coming from is you guys are a lot. I mean, we're deep, but to me, I'm just thinking very, on the surface. She's pregnant, and it's very common for pregnant women to have gingivitis.
Also, there's risk assessment that we can do based on what the heart defect is and then what the certain markers are, and we can tell her that exact risk. It's probably, if this is a major heart defect and there are multiple markers, it's probably going to be over 1 in 20.
Faculty members had prepared for their own roles on IPE Day in much the same way, working across disciplines on a case to explore teaching team care.
we want to do these things with our students, but as faculty, many faculty are not currently aware on how to engage in these types of activities or develop these types of activities. And so this was just a tip of the iceberg of getting faculty excited about IPE, explaining to them about what truly is IPE, because I think there's some misperceptions of what can count as an interprofessional activity. And so now that the faculty have a little bit more information about what IPE is and some opportunities that we can do, we can subsequently follow up from this event and do some additional teaching and development with the faculty on how to develop these types of activities moving forward for our students.
For the wrap-up, IPE co-director Congdon got the crowd to share eye-openers. Center Director Kirschling was on one mic and co-director Pechakonis on another, as students were asked to take on hurtful stereotypes.
Hi, I'm Erin with the School of Pharmacy. The myth I'd like to dispel is that we just count pills. We don't just learn about the drugs themselves, we learn about how the drugs affect the body, we learn how the body affects the drugs.
So I'd be interested to have somebody from each profession that would talk about, so we had
How about Law? Where's Law? She's got her hand up. I think she is ready.
My name is Evelyn from law school, and the myth that I want to dispel about lawyers is that we're like out to sue everyone. That's not true, and that's not what we're doing. That's not what we're learning to do. Other law students here would agree that we are trying to help people and help them access health care.
It would be good if we don't come in with predetermined ideas about what a profession is, because even though that is that person's job to earn your respect, if you meet them halfway and say, I'm going to come in with a neutral slate, I'm not going to make any judgments about you right away, then it'll end up making your entire experience with that person and with the entire team a lot better.
The day concluded with words of advice and the opportunity afterward for students to share their reflections.
We got to experience everyone's different views, but not only that, I appreciate more the different professions. But what I think people often don't realize is nurses are there consistently with the patients, and when the doctor leaves the room or when the counselor leaves the room, they don't understand something, the nurse is there, and they're the ones that need to explain that. So I think it's also important for the nurse to be kind of involved, or at least be able to listen to the conversations going on, so they can have a better knowledge of how to continue that education and support for the patient.
Everybody from different professors brought something unique to the table. So for instance, the nursing students, they talked about, for instance, kind of like the big picture things about, how do we care for this patient, but also the pharmacists, talking about medications, physical therapists, talking about their movements and whatnot. And so it was just very, it was reassuring in a sense that you were able to rely on a team that can kind of bring together their perspectives to best treat the patient.